Scots cycling legend Sir Chris Hoy has revealed he is being treated for cancer following a shock diagnosis last year. The 47-year-old, who won 6 Olympic gold medals between 2004 and 2012, said he was currently undergoing treatment such as chemotherapy and felt fine despite it all. His statement, which was posted on social media on Friday, February 16, didn't mention which kind of cancer he had been diagnosed with, but he did say he had no symptoms. Although this is sometimes the case, there are a few key signs of cancer that everybody should be aware of. According to the NHS, cancer can be detected in the body through a number of different symptoms or changes, which is why it's so important to make sure you're checking yourself regularly. Although these alone may not be anything to worry about, it's worth getting your symptoms checked by a GP if you're in any way concerned. The easier cancer is diagnosed, often the easier it is to treat, so here are a few of the key symptoms that everyone should know. Warning signs of cancer: changes in bowel habits. Speak to a GP if you've noticed changes in your usual bowel habits and it's lasted for 3 weeks or more. The type of changes to look out for include tummy discomfort, blood in your poo, diarrhea or constipation for no obvious reason, a feeling of not having fully emptied your bowels after going to the toilet, pain in your stomach or bottom, anus, your poo is loose, pale or looks greasy, bleeding. You should also speak to a GP if you have any unexplained bleeding, such as blood in your urine, vaginal bleeding between periods, vaginal bleeding a year or more after the menopause, postmenopausal bleeding, bleeding from your bottom, blood when you cough, blood in your vomit, lumps. Consult a doctor if you notice a lump in your breast or if you have a lump that's noticeably increasing in size elsewhere on your body. Regular checking of your breasts, underarms, groin and testicles is vital in order to spot any new lumps or changes. Moles. Speak to a GP if you have a mole that changes shape or looks uneven, changes color, gets darker or has more than 2 colors, starts itching, crusting, flaking or bleeding, gets larger or more raised from the skin. Any of these changes mean there's a chance you have melanoma, which is a serious type of skin cancer. Losing weight without trying. You should also speak to a GP if you've lost a lot of weight over the last couple of months that cannot be explained by changes to your diet, exercise or stress. Indigestion and heartburn. Some cancers can give you indigestion or heartburn and acid reflux. This can feel like burning in your chest, and make you burp or hiccup more than usual. Consult your GP if you get any of these symptoms regularly and are not sure why you're getting them. Feeling tired and unwell. With some cancers the symptoms can be harder to notice. It's important to speak to a GP if you think something is not right, or you keep feeling tired and unwell and you're not sure why. Join the Daily Records WhatsApp community here and get the latest news sent straight to your messages.